Good evening, everybody. My name is Authentic Grown, and welcome to another video of my channel called Common Sense. Now, tonight I'm going to be discussing a topic which is preparation for knee replacement surgery, and it's my own personal story. So, what I'm going to do in the time that I'm going to spend here, I'm going to share with you my own personal experiences as I went from preparation for knee replacement surgery to actually have the surgery and then the recovery. Many of you may not know, but I actually had knee replacement surgery done on both knees. Now, let me explain to you what's the difference between a partial knee replacement and a full knee replacement. A partial knee replacement, that's when they surgically remove a smaller portion of the knee. And a total knee replacement, that's when they replace the knee entirely. There's a cartilage that's in the knee, and what it does, it cushions the bones. So what happens when you suffer from arthritis, the cartilage is eaten away slowly and surely to the point where it's bone against bone. And in my case, that was the situation I had, not just with one knee, but with both knees. Now, some people are brave enough and actually get both knees done at the same time. Before you even think about that, you really need to speak with a doctor about that. I chose not to have both my knees done at the same time. Now, it is major surgery, so there's going to be a great deal of concern, and it's natural. So what you're going to do is, you'll discuss it with your primary care physician, and then that person will make a recommendation whether or not you see a specialist. And then what you'll do is you'll see the doctor, you see the specialist. The doctor will ask you some questions. And then they're going to do procedures done to see if that condition can be removed. Now, the first thing they do is they put a gel shot. So what they do is they take a huge needle and they inject a lubricant in the knee. What that does is it creates some cushion, but only temporarily. So then the next step is for you to undergo physical therapy. So you're going to see a therapist twice a week or 3 times a week, depending what is the scheduling and also depending what type of medical coverage that you have. You will see the therapist, and then what you would do is you will do a follow-up with the specialist, and then you will inform the specialist what is your progress. If the problem with the knee cannot be resolved with a gel shot or with therapy, the next step is surgery. Now, as most of us know, we get nervous when we mention the word surgery, and believe me, I was nervous as heck. But what you can do is ask a lot of questions. How does the knee get damaged? How does the cartilage gets eroded and whatnot? And then when you actually start talking about the surgery, what's going to be done? And you're going to see some other doctors. You're going to see a heart doctor. You're going to see another doctor regarding your lungs and what have you. So you're going to see, and they're going to undergo a whole series of examinations and tests. And then at some point, you will be given a date for surgery. And of course, it has to be approved by your medical coverage. Now, let me tell you this, and I'm going to say this, whether it be a knee replacement surgery, whether it be weight reduction surgery, whether it be a heart surgery, what have you. Do your research and really try to find someone who is an expert in the procedure. The last thing you want is have somebody who just got out of medical school to practice on you like a guinea pig. Now, you're probably going to get some information from the surgeon. It's going to give you like a manual of some sorts indicating what's going to be done, also indicating what's going to be done prior to surgery, during surgery, and then the recovery. Let me just tell you this. Knee replacement surgery is the easy part. The hard part is the recovery. And the reason why it's so difficult, because what you're doing is you're exercising the knee that was operated on. Because what they're going to do is they're going to put you to sleep, and they're going to put anesthesia to numb the knee. Now the nurse or someone from the doctor's office will give you a time and date to come in for his procedure. Usually, they will tell you to come in 2 hours before the operation. Please do yourself a favor. Do not get there late. You're going to be nervous as heck as is. The last thing you want to do is get there late, and then it becomes a hot mess. Now, one thing you have to deal with on the date of surgery, they're going to ask you the same question multiple times. What is your name? What is your date of birth? Why are you here? What procedure is going to be done? It's going to be done where? The reason why they do that is that they want to make sure that they're performing the correct procedure on the correct patient. So guess what? On the day of surgery, when you have your knee replacement surgery, you're going to be repeating the same thing multiple times. I went through that when I had my left knee done, and I went through that when I had my right knee done. And then what the surgeon will do, he'll take a magic marker and he'll mark where they're going to do the incision. You're going to see the surgeon. You're also going to see an anesthesiologist, a doctor that will put you asleep. And the operation itself, generally maybe 2 hours or so, at which time you're going to be asleep. And you're going to thank God that you're asleep, because think about it. They're going to put an incision. They're going to remove the damaged knee. Then they're going to put in a knee replacement, which is made of metal, plastic, and some other substances. And then they're going to close the incision. Okay? So from there, after you have the procedure, they're going to take you into recovery because I want to make sure that you have fully have recovered from the anesthesia. And then you'll be brought to your room. And guess what? If you have your procedure in the morning, rest assured, sometime in the day, they're going to insist that you get up and start the walk. Now, mind you, you're going to be walking very gingerly with a walker, and you're going to have assistance, and you have to undergo physical therapy. Now, this is where it gets difficult because what happens is the muscles where they perform the procedure become numb. So basically, you have to put the muscles back into shape. Now, be mindful. You're going to experience pain. So what they're going to do, they're going to give you pain medication to control and alleviate the pain. You may get it orally, or you may get it through your through injection or through a port. Okay. You'll be in the hospital maybe 3 to 5 days, which that time you're going to be doing physical therapy. You're going to be walking with assistance. And they're going to want you to be as active as you physically possible. Also, when you go to the bathroom, you got to use a walker, and you may need assistance to get in to use the toilet. And you will be doing a sponge bath to make sure that you are clean and you don't smell. Okay. So after you spend your time in the hospital, what will happen is the following. You will either recover home and you'll undergo physical therapy, or they'll send you to a facility which you'll spend maybe a week doing physical therapy so you can strengthen your knee. Now, as far as the recovery time is concerned, when I had my left knee down, replaced, I was out of work for 3.5 months. And what was my job? My job was to exercise my new knee so I was able to get from the walker to a cane, and then from a cane, walking without the need of a cane. Okay. Now, when I had my right knee done, it was a little different. Now, what I did was prior to surgery, I went to the gym. I tried to do exercises to the extent I was able. And I was able to lose over 30 pounds, which is very important because for every extra pound that you put on your knees, it creates more work. And the difference was when I had my left knee done, I was out for 3.5 months. When I had my right knee done, I was out 2.5 months. Okay. So that's the difference. So if you are overweight, the doctor is going to highly recommend that you try to lose some weight to ease on the pressure on your knees, on the knee. Okay. How was my experience with like? I'm not gonna lie. I was nervous. I was concerned, and to be honest, I was kind of scared. Now, what I did when I had, prior to having my left knee done and my right knee done, I did a great deal of research regarding total knee replacement surgeries. I also did the research as far as what may occur. I also did research as far as recovery time. I also did research regarding what I will need to do. Now, let me talk to you a little bit about how you're going to prepare um, where you're going to live when you get discharged from the hospital. Because what's going to happen is you might get sent home, or you may opt to live with someone else in the short term. Now, I was fortunate because when I was discharged, I was able to stay with my mother, so I was not alone. And of course, I had to make sure that the apartment was conducive for someone with recovery, which is make sure you don't have any loose rugs. Make sure that I had a bathroom bench, which is basically a large seat that you're going to put in the bathtub. Because believe me, when you shower, you're going to be sitting down at least for the first couple of weeks. Also got some other devices to help me to get dressed. Also, what I did was I was able to get short-term disability. And what that is, that's what you get when you're out for an extended period of time. Depending who is your employer and depending what type of insurance you have, you may be able to get short-term disability. Now, I was smart, and I'm going to tell you why I was smart. First of all, when I went out on medical leave, I had plenty of time on the books, so I was on payroll. So while I was out, I was getting my regular paycheck. Also, I got short-term disability. So I had some extra income because you never know what type of expenses that you have to cover that's not covered through your health plan. That's what I did when I had my left knee done and when I had my right knee done. Now, of course, loved ones are going to be concerned. It's natural. What you're going to try to do at least is to remain calm. And why? Because if you get nervous and upset, they're going to get nervous and upset. So, of course, my mother was very concerned about my well-being. First of all, she had lost 3 sons. So, of course, she's always worried about losing son number 4. So I managed to put a brave face and just reassure my mother that I'll be okay. And of course, I'm a Christian. I also prayed for God to give me courage to deal with this health situation. So I'm fortunate that I was able to go back to work within a matter of months. I was also fortunate that I did not have any episodes of me falling down when I was in the hospital or falling down, hurting myself. Because believe me, when you are in recovery in the hospital, they will insist if you need assistance, they're going to give you a call bell, and you're going to use that call bell to call the nurse or whatever to get you whatever assistance that you need. So in wrapping up all this, I'm going to state the following. You may know someone that has arthritic knees or is thinking about having a total knee replacement surgery. It's okay to be nervous. In fact, if you're not nervous regarding major surgery, something's wrong. However, knowledge is power. So what you do is you seek medical direction and medical guidance. And if you need to see a specialist, your primary care physician will show you or will instruct you and make necessary referrals if you see the correct experts. And then you will be given instructions. Follow them. And whatever you do, when they give you pain medication, take it. You're going to need it because you're going to be doing physical therapy and you're going to bend that knee. They're going to bend it again and again and again. And if you do not take your pain medication, you're going to be screaming bloody murder. And people are going to think that you're being mugged or you're being tortured. So in closing, I just want to say to you, it's okay to be nervous, but it's also okay to take the steps that you need to take in order to correct the problem with arthritic knees or any health problem that you have. So I thank you very much for listening to me. Now I'm going to ask you, please do me a favor. Please subscribe. Please hit the like button and hit the notification bell. So that way you can get a notification whenever I post new material. And I just want to let you know that this Sunday I will do a live stream regarding the role of a caregiver. Because the reality is this. At some point, most of us will either become a caregiver to a loved one, or we're going to need a caregiver to take care of us. So I'm going to close the same way I always close. People, please be careful out there because we are dealing with COVID-19 that has killed almost 650,000 Americans so far, millions worldwide. And there is a thing called the Delta variant. And many of the people who are getting sick are those who are not been vaccinated, who did not take proper care of themselves. And we must do everything possible to minimize our contact with the mentally and intellectually challenged. Because if we fail to do so, we will be infected by their stupidity and their insanity. So take care. I'll see you Sunday at 8 o'clock Eastern Standard Time, 5 o'clock Pacific Time. Take care and peace.